Against the backdrop of the death of 40 people to the upsurge of Lassa fever, the Nigerian government promises to intensify surveillance to ensure a zero level of Lassa fever infection. But does it have the resources to fulfill this mandate? Welcome to Question Time. I'm Benga Ashiru. You may also join us in this conversation by sending us your comments to our various social media platforms showing on your screen. In November 2015, the upsurge of Lassa fever sent panic across Nigeria, with the disease incidence spreading to 10 states. Could this be a case of dropping the guard and lack of vigilance? Now, who takes responsibility for this upsurge of the Lassa fever? To get to the root of this issue, Channels TV met with the Minister of Health, Professor Isaac Adewale. He says there's no reason to panic, while he assures Nigerians that government is on top of the situation. Professor Adewale further discloses that the federal government would ensure free treatment of Lassa infections. On the 221.7 billion naira budget, Professor Adewale says the focus will be on quality primary health care and development of teaching hospitals and tertiary institutions. Now, this interview is coming at a point when we can say the nation, Nigeria, is experiencing a resurgence of the Lassa fever. And you've said in the news as much that Nigerians don't have reasons to panic. But the country is in a state of panic. So could you put this into proper perspective?
Well, to be realistic, we are not really having a resurgence. What we have is what we call a situation where a disease has actually decided not to go away. And we are not really attending to it in the manner that is expected of a serious nation. We had the first confirmed case in 1969 in the Lassa village, and since then we've had Lassa fever actually being a pandemic, something that is there and has not gone away. We got to a peak in 2012 with about 1,800 cases. And since then, we've had a decline. Last year, we recorded 441 cases. What is unusual this year is the high case fatality. Usually, the case fatality over the years have been between 1 and I think at best 9%. This year, so far, we've recorded a case fatality of about 44%, which is alarming. When we look at the data, we have about 75% of the cases coming from 3 states: Niger State, Kano, and Bauchi. What is also worrisome is that in Niger State we recorded 35 cases, which actually dated back to about August, but not reported.
Now, permit me to come in here. What is responsible for the increase in the fatality rate in those states?
In Niger State, what will reduce fatality is early case detection, reporting in hospital early, making the diagnosis promptly, and starting treatment early. When you do any of those early, fatality will be almost zero. But when you could not detect early, you could not treat early, then you expect fatality to be high. In Niger State, this series of cases started in August. It was not brought to the attention of anybody at the federal level until November. And as of that time, we've had people said an unusual disease. It is the failure of the surveillance system at the community level. Because even when a disease is unusual, that is the time to report that disease. It's not the time to keep quiet. Niger, Kano, and Bauchi is contributing, well, the 3 states are contributing about 75% of the cases.
Who takes responsibility for the surveillance failure?
All of us. Surveillance is a nationwide responsibility. Individuals, families, health system at local government level, health system at the state, health system at federal. When we work together as a unified system, we will then have a robust surveillance system that will serve all of us.
Are you absolving the federal government of not taking responsibility in maintaining a zero resurgence rate in the reoccurrence of the Lassa fever?
Well, interestingly, health is not the exclusive responsibility of federal government. Health is on the concurrent list, is the responsibility of local governments, state government, and federal. So there's no way you can blame federal for what should have been taken care of at state level. In fact, the federal government is taking more than is expected because local government and state governments are not functioning properly with respect to air delivery.
What is peculiar about the high prevalence of the Lassa fever in the three states, Bauchi, Niger, and Kano?
Well, what is peculiar about Lassa is that this is an animal-borne infection. We've been able to identify the vector, which is a natural host, the rat, multi-mammate rat with multiple breasts. And these rats live in bushes and around our houses. And so what we have is that when the rats are infected and they pass urine or feces on food materials or items that come in contact with us, then we could get infected. So in all these areas, we could predict one, rat infestation, which could also be because of dry season. The rats have no food to eat, they move closer to the homes. We could also identify bush burning as driving animals closer to home. But what is also important is that we need the failure of the food preservation system. When food is well covered, we do not dry food stock, gari, cassava, and so on by the roadside. Then we can keep the rats away.
What are your intervention plans in rolling back this Lassa fever?
Well, the first thing we've done is to say, look, we have a current upsurge in the episode, an unusual high case fatality. What we're doing is one, a massive public education campaign, staying in touch with state and federal government and local government officials, dispatching surveillance officers to the affected areas and surrounding states. We are in fact reactivating some of the laboratories, making sure that cases are properly diagnosed. We've dispatched drugs, ribavirin, to affected states, and we're also sending them protective gears so that health workers can manage well. This is for the current episode. We're also planning ahead to ensure that next year we do not have a repetition. We're going to start right away by educating people. We want to partner with the Ministry of Agriculture on food preservation, food storage systems. We want to educate our people to live well and heighten the level of hygiene, and also be conscious with the way they store their food items. This upsurge is particularly heightened in 10 states.
You can also be part of this conversation by sending us your comments on our various social media platforms showing on your screen. Coming up on Question Time, what's the federal government intervention plan on the upsurge of the Lassa fever in Nigeria? Don't go away.